I want to talk to you about the key challenges facing vector control in our region. And this is the incredible diversity of mosquito species, complexes, one of which is shown here, Anopheles dirus. You can see that you got this white broad band on the tibial tarsal joint. We call these white kneecaps. So, and these kind of mosquitoes, and there's up to 6 species complex in this region, apart from dirus. They can complicate vector control interventions, especially when we have infallible tools that are currently used elsewhere, and this may be inadequate for malaria elimination. So it's helpful to understand the circumstances behind these obstacles and look at some possible strategies. Let's start with some of these charts. On the left one, you see there's an impressive decline of malaria cases being reported. I've selected only the Western Pacific. This is from the World Malaria Report. And you see some of the countries shaded in there, representative of WIPRO. And there have been significant efforts being made in reducing malaria burden, which also includes vector control. So the core interventions are shown in the lower panel, LNs, IRS, case management, etc. That make significant contribution to malaria situation. To accelerate progress, a global fund has announced in February 2013 that it would contribute $100 million to help support the emergency response to artemisinin resistance. Now, we have a decisions now how to allocate this new funding, these resources, if they are needed, and this includes how much to invest on vector control. In many countries with full coverage of ITNs, or long-lasting nets and IRS, malaria transmission will still continue, as shown in the rectangular area, which is termed residual malaria transmission, and is defined as you can see in that top right box there, all forms of transmission that persist after universal coverage with effective LN and or IRS intervention has been achieved. Going back to this slide, GMS countries are adopting and implementing ITN policies through mass distribution campaigns for all age groups, free of charge. According to the national strategic plans, 4 countries all conduct mass preventive IRS once or twice a year in endemic areas, generally targeting residents in communities not covered by Global Fund supported bed nets. In fact, the coverage is generally very low, with all countries placing much greater emphasis on ITNs. Malaysia is included here as a grim reminder that this program is challenged by emerging monkey malaria, for which there is no elimination strategy. Vectors of P. knowlesi are members of the dirus complex, which are also common in the Greater Mekong subregion, as shown in those red circles. One point about Malaysia is a long history of environmental management since the colonial times. They use a variety of environmental management tactics, such as subsoil drainage. We don't hear this kind of words these days. Subsoil drainage in swampy areas, bunding sluice gates in coastal areas, automatic siphons to regulate small river flow, small stream river flow, yeah. So, there you go, next one. I want to talk about issues with responsive focus spraying. In theory, the countries in this region conduct responsive focal IRS, either in the event of outbreaks in more endemic areas or when transmission foci are identified as a result of ACD in less endemic containment areas. The reality is RRAs has declined. There is limited focal spraying. Technical capacity is suboptimal. SOPs are not clearly set up. Thresholds for implementation are not well defined. Where travel histories are not used to determine local transmission among ACD patients, IRS is not timely and become wasteful, as shown in the top right panel, where the interval between the date of RDT confirmation and spraying has exceeded 14 days. Next one, down below, you see the open construction of most houses near the forest or forest margin present little barrier to biting, even for outdoor biting mosquitoes. And this makes IRS ineffective. On the other hand, IRS may be useful in development projects, especially in settlements with active transmission, such as those settlements around the extractive industry, plantation estates, hydropower projects. I want to talk more about this issue of prioritization. Lack of resources for vector control can produce undesirable consequences. The two graphs shows the effects in malaria morbidity when the southern provinces of Laos, this was done at the malaria program review late last year, they could not sustain continuous LN distribution due to insufficient nets, and the number of LNs dropped to low levels in 2010 and 2011 from relatively high numbers in previous years. And this was followed by a rebound of malaria cases, resulting in outbreaks in 2012 and 13. The take-home message is when there are insufficient LNs and withdrawals of bed net coverage, then an additional and preventable increase is expected in cases reported, especially in areas where transmission has been suppressed by effective vector control. In these circumstances, the first task for the Ministry of Health is to seek and secure resources needed to fill this funding gap. We also need to develop an interim strategy for damage limitation, such as a stratification tool to assist local program managers to plan distribution of LNs. The aim of this tool is to assist and define geographical areas to which levels of coverage can be assigned, such that overall malaria burden resulting from incomplete coverage will be minimized. I want to move to the next issue of outdoor biting. In my introduction, I mentioned behavioral heterogeneity of malaria vectors. This slide is taken from a colleague, Mark Kusemans, and he's done extensive work in Vietnam and this region. And from this slide, we can say that this heterogeneity can range from highly exophagic, this one here, where you see the index ranging from 1 and up to here, which means that these mosquitoes have strong tendency to bite people outdoors. And on the other hand, going to this side is endophagic, which means the tendency to bite indoors. So where you have these ones, it's okay to use nets or IRS, but not for this situation here. So here are at least 5 Anopheles species behaving this way. So what does it mean? It means that these are evading vectors capable of maintaining residual transmission, even with the same species, Anopheles minimus, this one, that shows divergent feeding behavior in Vietnam and Laos on the right panel compared to Cambodia in the left panel, indicating that this vector control may or may not be appropriate for all settings in all locations. Another aspect of mosquito behavior is that under certain circumstances, feeding occurs early in the evening before people retire under bed nets, and this undermines the impact of ITNs. In Vietnam, right panel, taken from Kusemans and Van Bottel's paper, and Western Myanmar, taken from Smith's paper recently, 60% of the bites were acquired before sleeping time. This part of the malaria transmission has the possibility to continue despite high coverage of vector control. And the term, we call this residual transmission, applies to this situation. So as shown in the left panel, the early evening biting pattern and strong preference for outdoor biting in Western Myanmar provide what we call partial protection for children against malaria. This was a conclusion reached by Smithers et al. And these and the previous studies argue against generalizing ITN studies from Africa, to the Greater Mekong sub-region. Let's explore this early biting phenomenon in our region. We see that there are different patterns of early biting of the same vector that have been observed in the region. So we say that this may interfere with the response to ITNs according to place and season. So here you see that going from late biting to early biting, and you see all these multiple species here showing this kind of early biting, this variability too. So there is no simple rule to determine where vector transmission or vector control interventions will be most effective. So we still do not have a full grip about understanding of the behavioral actions of these treated materials. They are more complex than initially thought, and we need further studies to understand the influence of environmental conditions, how much environment will interfere or affect these the performance of these tools. So let's go to this one here. We said that Anopheles mosquitoes generally bite between 6 p.m. sunset to sunrise, 6 a.m. And ITN will only protect from infective bites that are acquired indoors and during sleeping time. IRS only target mosquitoes that raise indoors. Therefore, we say that there is a gap, as shown in these two red bands here, in protection, both indoors and outdoors, before and after people go to bed, but also for people conducting outdoor activities during the night, risk behaviors. So this protection gap is quite significant in this kind of scenario. So let's go to the next one. So we therefore need new paradigms to close the gap for controlling and interrupting malaria transmission, and people need to adapt them according to local context for good efficiency. I want to talk more about this transmission ecology, a slide taken from Jerry Killen, and we say that we really don't know much about the vector distribution and transmission ecology in the forest mosquitoes, how they interact with people in terms of biting behavior and bionomics. We know that there's a rapid ecological change, deforestation, plantation developments, emergence of new economic zones, and this pulls people together into this kind of environment. And this puts forest workers and military people at risk, increased risk of drug resistance, malaria parasites. They do not usually have access to effective protection. And there is a need now to pilot. A lot of noise has been made about piloting, or shown in these red bands here. New products, such as insecticidal harmonic nets, spatial repellents, topical repellents, even sugar beds. We call this sugar toxic beds. And let's look at how they perform in this kind of environment. So going to the bottom panel here, we say we need to integrate vector mapping with epidemiology to provide a more precise understanding of this risk in this ecological setting. And we also say that stratification of malaria risk will become increasingly important as ASEAN enacts the laws for free population and labor migration throughout the region, when the foresight becomes more limited. I want to talk about the topical repellent. This is an interesting one. This one pops up late last year when I was in Laos, and we noticed that the Cambodia, Laos, Thailand programs provide repellents to artemisinin containment project areas, to spatial at-risk populations. But few programs have invested in the assessment of these tools. So the results of this RCT household study was interesting. It showed no effectiveness, perhaps due to design issues, and what is important is compliance was quite low, 48 to 60%. So here we go. Even no data on user preference and acceptability. So there's still lots to figure out what to do with repellents in this region. So this is a very mixed slide here, and let me take you through to other insecticidal treated materials. For example, hammock in Cambodia, 50% or half of the vector bites can be avoided just by sitting in the treated hammock, as shown in the left panel. However, when you combine the permethrin treated nets with the DEET, they almost confirm 99%. Now, this figure is a bit small, but Maxine Besnier will talk more after me. He will elaborate on this point. And we also note that the long-lasting insecticidal hammock net may reduce malaria incidence prevalence in remote forested areas in central Vietnam. So these are encouraging tools. And incidentally, the Malaria Consortium is planning a randomized control study, a crossover study on the preference and acceptability of this impregnated clothing in due course. Going to the lower panel here, there was a report that says that 70% of nearly 1 million bed nets, family-sized bed nets and hammock nets have been imported into Cambodia. Yet, the cost effectiveness of this approach has not been examined, or at least I've not seen this kind of analysis. This needs attention when you have such large volumes of treated materials coming to the country. And we know that we heard this morning that the incidence of malaria is dipping down quite fast in Cambodia, and therefore we end up with this thing called foci. So is it cost effective to still import millions of nets when you have limited foci? Now, I want to talk more about the Global Fund financing. They provide over 310 million long-lasting nets from 2002, during its inception, to 2012. And therefore, this has resulted in a dramatic increase in bed net ownership all over the world and increased utilization. But we still are quite ignorant about the durability. There's a significant paucity of information about the durability of these long-lasting nets. We need answers to these questions quite quickly. The nets, according to Hooper, says they last up to 3 years. What do you do after 3 years? Do you replace them? And we need decisions to support management of resupply, replacement, and inform these kind of things at global level for procurement decisions, and perhaps to encourage competition in the LN industry. I want next to talk about insecticide resistance. 2 years ago, there was a WHO plan to establish a network of IRM, insecticide resistance monitoring in this region, through the auspices of Act Malaria, to provide technical support, data validation, sharing, exchange information for decision making. I would be interested to hear from the countries about the progress and the challenge of this kind of regional network. The second issue is the GPERM sample size collection of sample size, the number of sites, sorry, it's a sentinel site selection. It's an issue too, and there's a formula that is put on this slide, and what to do if you have less than 500,000 bed net procurement, and also issues regarding whether you do it in TA sites or sites that have got the problematic areas. And the tube assays, there's also issues about the two methods of what I call the bottle assays, CDC assays, WHO test kit assays, and especially when the WHO requires advance payment in US dollars. Okay, right, I think I better wind down quick and fast. So let's move up to the last slide, okay? Right, so there are opportunities to introduce appropriate technology to provide alternative prevention tools, to research to address outdoor transmission, Also opportunities for greater private sector engagement in the region. This is clearly a key sector, and its potential needs to be better understood and accepted in prevention planning. And achievements in malaria control could also inform efforts to control the increasing regional burden of dengue. Nobody has talked about dengue, yet it's one of the significant public health issue in this region. The Global Fund has enriched and empowered the countries to tackle malaria control. Dengue, a poor cousin, has been neglected or marginalized. We need to transfer the lessons learned in terms of, like for example, what better methods we need to quantify dengue endemicity using some of the parasite prevalence surveys that Aransa has talked about this morning for endemicity mapping that's used for malaria. Right, thank you.